Going to demonstrate the Complex Care Manager program. About 8 or 9 years ago, Medicare started a program whereby patients who had chronic problems and took more than 20 minutes outside of an office visit per month could get paid an extra $45 or so. Many times this management was done by a nurse or other staff member, but also sometimes by a clinician. The hard part, as always, is tracking the minutes and being able to bill for this. I created a program to help make this fairly straightforward. I will demonstrate that now. Just choosing a test patient, Edward test. Let us say I want to contact Edward by cell phone, and I'm going to talk to him about disease management. Once I get into the chart, I would start the timer, and then I would call Edward. Let us say we're talking, and I document what we talked about. And timer is going as I talk to him, and it keeps track of how much time I'm spending on this one task. I can pause the timer, let's say, because someone interrupts me and I have to do something else when I was working on his stuff. I can restart it. And then what happens is at the end of that time, I just say stop. And it will create a report that says what I had typed or what I had done during the visit and the amount of time I had spent on the visit. I can see past cases. I can also, if it was done on time, this one was not done on time, I can see what was done during that contact with the patient. I can change the demographics of the patient. It used to be there are specific diagnoses that are supported by Medicare and the Complex Care Management Program, so you could enter those diagnoses if they're not already known. Another big thing is you can generate a report at the end of the month. For example, let's just say, normally you would do it per month, but I haven't used the program a lot in a while. So let's just say I'm going to pull all the reports that were done. Then I want to see the number of patients who met the 20-minute criteria for the time frame that I'm looking at. Sorry. And this tells me how much time was spent in each case, in each patient. If I had insurance information, that sort of thing, I would save to file as a comma separated variable and send it to my billing people to submit billing. It also includes the diagnoses and the time period, which makes taking care of this issue very easy. Another requirement of the complex care management program was you needed to create a care plan. So I've created a simple way to do that by just using checkboxes and as well as free text. So if I were to choose some of these things, I could very easily create something for the patient to view as a care plan. Let us say the patient does not speak English. I could also have it created in their language as well as including English if I wanted to for each of these. So you can create a care plan as we go, and all sorts of possibilities exist. Let's view some of the prior care plans just to get an idea of what is possible. This was a formerly created care plan. It also has the ability to put in parameters based on the patient's diagnosis, and the person creating the care plan can mark it off as red, yellow, or green, depending on how well they're doing. It also can be translated into the language of choice for the patient, as well as in English. You can compare prior care plans, and let's say you wanted to compare 3 different prior care plans. so you can see what changed over time. And you can see it also supports more than just Spanish. This one I think is in Dari, possibly Arabic, because I don't read either one. But you get an idea of what is possible with the care plan manager. So this is all a pretty straightforward program, but allows your office to bill for staff time that normally would be not supported by any reimbursement.